Leah Lamattina has over 17 years of experience serving children, youth, and families, currently leading foster and homeless youth education services at the Humboldt County Office of Education. Her work focuses on cross-sector collaboration, trauma-informed practices, and building coordinated systems of care for youth navigating homelessness, foster care, and juvenile justice. She is a strong advocate for equity and community wellness and is a certified master practitioner in the Compassionate Systems Awareness Framework. Our next presenter is Dr. Peter Stoll. Peter trained in school and counseling psychology at the University of Massachusetts in Amherst. He has specialization and expertise in behavioral psychology, mental health service delivery, and system-wide approaches for promoting positive school culture and climate. Peter is the Director of Prevention and Intervention Services at the Humboldt County Office of Education and holds credentials in school psychology and educational administration. He is a certified trainer with the International Institute for Restorative Practices and is the Region 1 lead for California MTSS and California PBIS. He is a board member of California Mental Health Advocates for Children and Youth and sits on the Humboldt County Behavioral Health Board. And with that, I am passing the mic over to Leah and Peter.
Well, Paulina, thank you. Hopefully folks can hear me. Thank you for that introduction. And it's an honor to be here. Right as before she did that, I was scrolling through who everybody's here. And it's safe to say that we're among friends. And so thank you for being here. I also just want to recognize that, Leah and I have been on this journey together, and I'm really grateful for the partnership that we have within our department to be doing this work. Leah and I and our programmatic funding analyst, Mike Magana, who some of you might know, have been at this for some time. And we could talk a little bit about the genesis of that. So, there are other folks in the room that probably know just as much or more as us. So I think the best learning environments are the ones that are reciprocal. So, our hope is that by putting this out there, that we sort of ignite a conversation that will bring some more information our way, and that we can share in the journey, because the opportunity for ECM is pretty exciting, and we hope to make it a reality in short order. So you can progress the slide, Leah. And a little bit about our department. I'm going to go fairly quick here. We don't have too long, but Humboldt County, as most of you know, if you have been here, or if you haven't, you know that we're rural. 31 counties, 14 charters. Some of our schools, from where I sit in Eureka, are an hour and 45 minutes away. Some of those schools have as few as 6 students, maybe 20 students. So lots of blended classrooms, lots of, second highest rate of ACEs scores to some data in the state, or the highest with Butte County, actually. In our department, we have Leah's team, foster homeless, our mental health and wellness program, which is growing. In this meeting, Rebecca Dixon is here. She's our program manager for mental health and wellness. She'll be at the conference on Thursday and Friday. Connect. And we also have our school attendance work. School safety is in here, and then our school climate department as well, which is where we house a lot of the frameworks: MTSS, PBIS, UDL, restorative practice, all that stuff. So anyway, that's us. That's our department overview. I'm not going to read you this slide, but I am going to quickly say, Mike Lombardo and I were on the phone. I think it was maybe, I know it was dark out early, so it was winter at some point, but we were having a conversation about ECM and how that might relate to the schools. And the Cal AIM funding that was there to work with populations. I'd had a conversation. I wasn't really quite sure how that would fit in education, but then Leah and I had the opportunity to be working with our partnership healthcare, our managed care plan connection, who we had met through the work that we had done with SBHIP. And he was able to connect with Leah. Leah talked about the work she was doing in foster homeless. And it was not that long after that Paul Richmond, another wonderful consultant who's on this call, who'd been working with partnership, Mark said, "Hey, can we have a little conversation at the end of this call? We were talking about SBHIP, probably program plans or something, project plans." And so he basically said, "Hey, you're doing this work already, and there's this thing called ECM, and it's to work with vulnerable populations, to do preventative work. And these vulnerable populations are the ones that are the most expensive to the state. And we really need to look at expanding this service into the school milieu." And I'm going to let Leah talk about her program specifically, but expanding services for our youth. We have an estimated 1,000 youth in Humboldt County of our 17,000 students that would qualify for this type of intervention, that are either foster or unhomed. So I'm also just going to say before I pass it off to Leah is that all of us in this room that are doing the work with the fee schedule and our wellness coaches are faced with the reality that we've just seen what was released by DHCS, the activities that we're going to be able to bill for. And we've all seen models that some say that we're going to recoup 30% of the cost, some say that we're going to recoup up to 60, who knows? We really don't have that proof of concept yet. But what we do know is that we have to braid funding and we have to expand our ecosystem of mental health service. So we are looking at ECM not only as having a focused case manager within our foster homeless doing this work, but we're looking at our wellness coaches being able to have small caseloads of ECM, enhanced care management, doing preventative work with these vulnerable populations so that we can bring in that other funding source and braid that funding, but more importantly, reach more students that need that support. I hand it to you, Leah, with the next slide.
Great, thanks, Peter. So as Peter mentioned, it was probably about 1.5 years ago that we were approached by Partnership Health Plan. And from that point on, we did a lot of internal planning to see if this was an area that we wanted to put some of our energy into. And so we began our conversations with Partnership Health Plan at the end of the last school year, specifically around enhanced care management and Cal AIM. And then we began at the beginning of this school year, sort of the process to become a provider, an organizational provider of enhanced care management. I will say that the process to become an organizational provider is pretty lengthy. It is slow moving on the managed health care plan side to approve applications and then move you through the different processes. And so we were told at the start of this initiative that it could take up to 6 months to become a provider. So as you listen to this presentation, or as you learn more about ECM, or depending on how much you already know about ECM, you may want to consider starting these conversations now and not let it sit until you're ready, because it will be a lengthy process and you can kind of do some of that infrastructure building work at the same time that you're moving through the process. So currently, the phase of the process that Humboldt County is in what they call credentialing. And it's credentialing / contracting, because they kind of, so they, so we have submitted what they call a PARF, and that was, well, we did a self-assessment and then we submitted a PARF And they sent us what's a boilerplate contract. We were able to access our general counsel for the contract piece, and we were greenlit through, well, we use School and College Legal Services up in Humboldt County Office of Ed. But School and College Legal Services and our risk management folks met and they greenlit the contract. So as soon as we are done with the credentialing phase on partnership side, we will be able to quickly be able to get the contract signed and hopefully begin serving client students. The partnerships that we're building alongside the work with sort of that background work with partnership is with some of our community-based organizations. And so up in Humboldt County, we have a nonprofit called the North Coast Health Improvement and Information Network that built a community information exchange. And so the community information exchange platform that was built here locally is a organization and a platform we are partnering with in the Foster and Homeless Youth Ed Services program to help us do case management and referrals directly towards the enhanced care management work. And so that is one partnership that we have been strengthening and building in preparation of becoming a organizational provider for ECM. And then also, while we're in the credentialing process, we were told would take 30 to 45 days, although we are also hearing that it could take 45 to 60 days, right? And so like when I say the process is on managed health, managed care plan is long, it is long. So while that's been in process, we also looked into the path-cited round 4 application, which we submitted 2 weeks ago. Let's get some infrastructure to begin ECM work.
I'm just going to add just quickly there that, Leah highlighted the CIE, the Community Information Exchange, and that it has an extension, an aspect of it that can handle ECM. We're going to be piloting that, but I just want to be clear that unlike the fee schedule, with our managed care, you do not have to have sort of an EHR, a vetted EHR, electronic health record system. As long as you're submitting those points of contact through the claim system, they will do that in many different formats. As a matter of fact, when we talk with managed care about this work, we keep being surprised about how few explicit requirements there are. For example, when we become, a contracted organization, so we become credentialed through managed care. At that point, there's training that needs to happen for the community health worker status. That is going to be handled in-house by us through sort of training scope and sequence that exists out there, but that is up to us to do that. We identify a lead care manager who will help manage those plans and supervise that work, and then there'll sort of be this provider portal that then we ask for that authorization to treat, and then what also happens is that ECM and partnership, for us, partnership health plan, but the managed care system will actually reach out and train our staff on how to submit and track those services. So it feels like a wonderful collaboration there. So I just wanted to add that. We go to this next slide. I'm not going to belabor this slide. This is just, we all have initiatives on our plate. In Humboldt County, our wellness coaches are an extension of what a project that we started years ago with our Department of Health and Human Services, Children Behavioral Health, called Humboldt Bridges to Success. We've rebranded that Humboldt Bridges to Wellness. And what we've really done to shift that work is the scope of work that they're doing is no longer just triage of mental health, but it's really integrating into the schools, as centers of wellness, and doing the preventative tier 1 and tier 2 work, as well as the case management for those higher level needs in partnership with our Department of Health and Human Services. For us to be able to maintain that, we were able to secure the HCI grant. Thank you to HCI. Our round 5 through the CYBHI for evidence-based practice work. And so we're braiding those funds as we get our feet under us with the fee schedule. So we have hired 7 wellness coaches that are doing some of that work, one dedicated to our chronic absenteeism work. So we'll go to that next slide. I'm aware we have about 3 minutes here. But you know, this idea, we're hippies up here in Humboldt, so we're calling them holistic wellness coaches, but they are certified. And but we're looking at the potential of them also being in the role of community health worker. It is preferred in this work with ECM that we are that folks have lived experience and they're coming to this. So as they recommended, they said start small, which is what we're doing. Leah did mention a grant that we are applying for that's due on Friday, the cited grant. It's the Path Cited funding grant. We're hoping to have a dedicated person with our foster homeless youth that are doing just this ECM work with enhanced care management, growing this, and then introducing it to the rest. Wow, I still have 10 minutes. All right. Well, we have a little more time than I thought. Did you want to add anything to that, Leah? Around the vision of the coaches and the person that we hope to get on your team?
But I think that you mentioned it earlier, and it's notable that the role of the community health worker, it can be done in-house. And that was one of our challenges. It slowed us because we were unsure of how to create a training infrastructure for these positions. And then once we met with partnership to kind of talk about our challenges, we were told that all of that work, all of that training, the competencies for the provider can all be done in-house, which will really fast track our ability to provide the service through the wellness coach / community health worker. Go ahead, Peter.
So, we're really, looking at these strategic partnerships. One thing that's not on the slide that we're really being mindful of is, I think some of you in the room might know about the interagency leadership teamwork with AB 2083. If you don't, that's okay, but it's really about looking at true integrated services across our service providers and the organizations that exist. So we've been doing some really robust work around that, and within that work, this idea of ECM has come up. And what is pretty interesting, which I just share with this group, is that what's unique about ECM is that the client, or the person who's receiving the service, can choose what provider they'd like to have provide ECM for them. So, what's interesting about that dynamic is that could put us in competition with one of our community-based organizations. Like, hey, we can provide you ECM, or we could, because it's fairly lucrative. It does, it reimburses at a higher rate than the fee schedule. I believe, I'm going to say these numbers, Leah, correct me if I'm wrong, but I think that it's about 150 at the initial sign up of somebody, and then monthly it's about $500. So we're looking at initial sign up about $650 per person per month for a one-time visit that's signing them up. Then after that, it's $500 per visit. And so, we start doing the math and we think, well, one, we have people out there that are needing this service. So if you've got a wellness coach out there who's maybe doing 4, that's $2,000 a month. At 10 months, that's 20 grand to braid into the other work that they're able to recoup through the fee schedule. And given the climate of the world right now and some of the uncertainties, I think, it's hard because I think there's a lot of us out there that got into this work not to be business minded, but we have to be thoughtful of what's sustainable and what's not. And so that's why we're starting small. It's why we're trying to grow this and, and create a pilot so we can say, well, we can do this. And not only can we do this as a county office, because we're really going to have to encourage our districts to also hire and train wellness coaches and leverage the fee schedule. And all but 4 of our 31 districts are in our consortium here with the fee schedule. So anyway, I know I'm rambling at this point, which is a good sign because there's much to say, but we hope that what this does is it brings up some conversation around these possibilities. Paul Richmond has been a great help. Mike Lombardi has been a great help. They'll be, I bet, in Sacramento and willing to talk about this. Come talk with us about it, because some of our challenges are really going to be like, what is the infrastructure that we need, right? What about the it is true. It's been taking a while for our credential and contracting, but I will say, and maybe, I don't know if all of our managed care plans are similar, but partnership, the wonderful thing about SB-HIP is it took schools and it put us in relationship with an organization that we didn't know what they did in the past. And now we have these lasting relationships with partnership, and their goal, our managed care, and their goal is to, is to increase their service and their reach for these vulnerable populations. So it's very symbiotic. So they're helping us, and they're there. So all I want to say is that we met with them the other day. Leah said, hey, we were told it was going to be about this long. They said, yes, it can take this long, but we're hearing you and we're going to try to expedite this. So there's just this really nice collaboration that's happening. Our opportunities is, 10 years ago when we talked about braided funding in Humboldt County, people said we don't braid funds. Now I think, we're doing the work at breaking barriers. We're having the conversations. We're growing these positions. We're expanding our mental health. We have to braid funds, and we have to do this not only within our county offices, but we need to do this with our community-based organizations and with our Department of Health and Human Services, and we're doing that. So putting that there, yeah, and I'll let Leah say thank you. But anyway, we're rounding into the end here. Thank you so much. Hope that was clear. Lots of moving parts. It's always a privilege to be able to have a voice in such a wonderful community.
Yeah, I will also say thank you. And we did go over time, which we sort of had a feeling we would. So we apologize about that. I am going to turn it over to Caressa to bring us into the break. And I know there's opportunities to talk more after the break on ECM.